If you've ever dealt with itching, peeling, or that white, soggy skin between your toes, you're not alone. Most people often treat it the wrong way, and it only makes things worse. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Over the years, I've discovered there's one big mistake that everyone tends to make while trying to fix this problem. What's even more surprising is that this mistake is actually recommended by many well-meaning doctors and pharmacists. In today's video, I'm going to show you exactly what this mistake is and why it keeps the fungus thriving. And most importantly, what you should be doing instead. In today's video, you'll learn the real cause of that persistent fungus, the treatments that actually work, and how to prevent it from coming back again and again. That itchy, peeling skin between your toes is usually a type of fungal infection called athlete's foot, or tinea pedis in medical terms. But here's what most people don't realize. Not all athlete's foot is the same. The type that occurs between the toes is specifically called interdigital athlete's foot and requires a completely different approach than the kind that affects the bottom of your foot. The fungal infection loves warm, moist, enclosed environments, exactly what exists between your toes, and when they're squeezed together in shoes all day. The symptoms are pretty distinctive: itching, burning, white soggy skin that peels away, and sometimes cracking and even a foul odor. If you're finding this information helpful so far, please take a moment to hit the like button, and this helps others with similar foot problems find this crucial information. Now here's the number one mistake people make when treating fungus between their toes: using moisturizer or cream-based treatments. This might sound counterintuitive because the skin is flaking and peeling, which makes many people think it's dry skin that needs moisturizing. But here's the critical point. This isn't dry skin at all. It's actually skin that's too wet. When you apply moisturizer or cream-based antifungal treatments between your toes, you're adding more moisture to an already too moist environment. This is exactly what the fungus wants. You're essentially feeding the fungus and creating the perfect condition for it to thrive and spread. Think about it this way. Fungus is like mushrooms. Mushrooms grow in a dark, damp environment. If you wanted to kill a mushroom, would you water it more? Of course not. The same principle applies to fungus between your toes. This mistake is so common because when people see it flaking, peeling skin, their first instinct is to moisturize it. Even many healthcare providers automatically recommend cream-based antifungal medications without considering the specific location of this infection. But between the toes, this approach can actually make the infection worse, longer lasting, or recurrent. If you know someone who's been struggling with persistent fungus between their toes, please share this video with them. This simple information can save them months of frustration and discomfort. So what should you be doing instead? The right approach is actually the opposite. You need to dry out the area between your toes. Here's a comprehensive strategy that actually works. First, keep the area dry. After showering or swimming, dry thoroughly between your toes with a clean towel or tissue. Pay special attention to the spaces between each toe. Some of my patients even use a hair dryer on a cool setting to ensure this area is completely dry. Second, use the right type of antifungal product. For between the toes, gels or foams are far more effective than creams or ointments. These formulations can help absorb moisture while delivering an antifungal medicine. Look for products containing clotrimazole, miconazole, or tolnaftate. The application technique matters too. Don't just apply the product on top of your toes. Actually separate your toes and apply the product directly to the affected skin between them. This ensures the medication reaches exactly where it's needed. If you're finding this information valuable, please hit subscribe button and notification bell. I post new videos every week with crucial information about foot health and treating common foot problems. Timing is another critical factor that most people get wrong. Many stop treatment as soon as the symptoms disappear, but this is a mistake. The fungus can still be present even after symptoms resolve. Continue using the antifungal for at least 1 week after all symptoms have disappeared to ensure your infection is completely eliminated. Your choice of socks play a major role in preventing and treating toe fungus. Cotton socks absorb moisture, which can help keep the spaces between your toes drier. However, synthetic moisture wicking socks can be even more effective, as they pull moisture away from the skin and allow it to evaporate. Changing your socks at least once daily is essential. If your feet tend to sweat a lot, consider changing them even more frequently. This simple habit can dramatically reduce your risk of developing or maintaining a fungal infection. Your shoes are another critical factor. Closed, non-breathable shoes create the perfect environment for fungus to thrive. Whenever possible, wear sandals or open-toed shoes to allow air circulation between your toes. If you must wear a closed shoe, choose from breathable material. Never wear the same pairs of shoes 2 days in a row. Shoes need at least 24 hours to dry out completely after being worn. Rotating between multiple pairs allow each pair to dry thoroughly, reducing the fungal load that could reinfect your feet. Consider using an antifungal spray in your shoes as well. This helps to kill any fungal spores that might be lurking in your footwear, waiting to reinfect your feet. Spray the inside of your shoes at night and allow them to dry completely before wearing them again. For severe or persistent cases, you might need prescription strength treatment. This includes oral antifungal medication or stronger topical solutions. Don't hesitate to seek professional help if over-the-counter treatments aren't working after a few weeks of consistent use. Here's another important point that is often overlooked. Check your shower or bathtub. These wet environments are perfect breeding grounds for the same fungus that's affecting your feet. Clean your shower regularly with antifungal cleaner, and consider using shower shoes if you share a bathroom with others. Swimming pools, gym locker rooms, and hotel showers are also common sources of fungal infections. Always wear flip-flops or water shoes in these public areas to protect your feet from picking up new fungal spores. If you're dealing with severe case of cracked skin or signs of bacterial infection, such as increased redness, warmth, swelling, or discharge, it's important to see a podiatrist right away. What started as a simple fungal infection can become complicated by bacterial infections, especially if the skin is broken. For diabetic patients, any foot infection requires immediate professional attention. Due to potential circulation and nerve issues, even a minor fungal infection can quickly become serious for someone with diabetes. Don't attempt to self-treat if you have diabetes. Seek professional care promptly. Prevention is often easier than treatment. Once you've successfully cleared the fungal infection, maintain good habits to prevent recurrence. Continue to dry thoroughly between your toes. Use antifungal powder preventatively if you're prone to recurrent infections, and maintain good footwear habits. Remember, fungus between the toes is extremely common, but doesn't have to be a recurring problem. By avoiding the mistake of adding moisture instead of focusing on keeping these areas dry, you can prevent these uncomfortable conditions. If you're struggling with persistent fungus between your toes that won't respond to over-the-counter treatments, schedule an appointment for a professional evaluation. The link to do so is in the description below. Sometimes what appears to be a simple fungal infection might be something else entirely, or might be complicated by other factors that require professional care. Please take a moment to like this video and share on social media. Your simple share could help someone find relief from a problem they've been struggling with for months or even years. Also, leave a comment below if you have questions about fungal infections or other foot problems. I do my best to respond. Thanks so much for watching, and have a great day.